Good Tuesday morning to everyone, and welcome back to day 2 of the Division of Mental Health and Addiction INARMS Symposium. First off, we'd like to thank our sponsors that are partners in change. Wooded Glen Recovery Center. Wooded Glen Recovery Center in Henryville, Indiana offers evidence-based treatments for individuals struggling with drug or alcohol addiction. Thank you, Wooded Glen, for being a partner in change. Sycamore Springs. Sycamore Springs is a recovery center in Lafayette, Indiana, with 3 locations offering mental health programs, substance abuse programs, and specialized programs. Sycamore Springs, thank you for being a partner in change. And Meridian Health Services. Meridian Health Services is a progressive healthcare organization that believes in treating the whole person, integrating physical, mental, and social well-being to help people achieve their optimum health. Meridian Health, thank you so much for being a partner in change. Thank you to all our sponsors for day 2, session 1. And here, joining us again is Blake Wood, our conference MC. Blake?
Thank you, Sunny. Good morning, everybody. Welcome back to the Symposium for INARMS for 2020. Our first presentation this morning is entitled Kraft Model, Support Group for Families and Affected Loved Ones, and our presenter is Justin Phillips. Justin Phillips is the founder and executive director of Overdose Lifeline, an Indiana-based nonprofit organization dedicated to reducing the stigma of substance use disorder and preventing deaths resulting from opioid overdose. Since 2014, Overdose Lifeline has served as a statewide nonprofit addressing the opioid public health crisis through subject matter expertise, education, advocacy, and support for affected families. Justin spent most of her career in public health and the prevention of unintentional injury and death to children. She received a degree in philanthropic studies and nonprofit management in 2011. When Justin lost her middle child, Aaron Sims, to a preventable drug overdose death in 2013, she formed Overdose Lifeline to create awareness and save other lives. Aaron's Law passed in 2015 and is named after Justin's son. It allows for over-the-counter access to the overdose drug naloxone, also called Narcan. Justin has been invited to speak at national, regional, and local meetings on the topic of the opioid national health crisis. She's received local awards such as the Fairbanks Circle of Hope Award, the Drug-Free Marion County Parent Advocate of the Year Award, the Indiana Jefferson Award, and was chosen as a 2016 White House Champion of Change for Advocacy, Prevention, and Treatment. The Indiana State Health Commissioner awarded Justin the Excellence in Public Health Award. In 2017, Justin testified before the President's Commission on Combating Drug Addiction. In addition to her work with Overdose Lifeline, Justin has a master's degree in clinical addiction counseling and provides counseling services in the Indianapolis area. Justin, we're very much looking forward to your presentation, and we'll now turn the floor over to you.
Thank you, Blake. Good morning, everyone. Thank you so much for the opportunity to be here to join you for the Indiana Recovery Month Symposium and Recovery Month, joining the voices together and connections and the importance of connections. And I think that our topic this morning, as it relates to the recovery of the family and the importance of family and connections for an individual's recovery. So I'm going to turn off my webcam so that I don't get distracted by myself on the screen this morning and get started. So thank you for that nice introduction. As Blake mentioned, Overdose Lifeline is a nonprofit based here in Indianapolis. We do a variety of things to serve the state and to address the opioid public health crisis. And we invite you to visit our website to learn a little bit more about what we do. Next slide, please. So this morning, as Blake mentioned, and as I mentioned, we're going to talk about Kraft Family Support Group. Kraft is an evidence-based model. I'll discuss in more detail how the Kraft model works and the importance of family support as a connection for recovery. Often the family is sort of left to the sidelines when we talk about helping an individual find recovery, and really it's the forgotten important link. And family support matters so much. And I learned about this story from the White Bison Group, a Wellbriety. It's a group of Native American recovery supports, and they talk about the healing forest model of positive community change in the healing forest story. And the story goes like this. Suppose you have a 100-acre forest, and in that forest there is disease or sickness. All the trees are sick. It is a sick forest. Suppose then you go to the forest and you take one of those sick trees and temporarily uproot it and put it under your arm. You walk down a road and you put it in a nursery where there is good soil, or you take a young person, you take them out of the community and you put them in treatment. So now you have this tree in good soil and it gets healthy because it is getting sun and rain, it is getting well, it is turning green. You get this tree to be well and you take this well tree back to the sick forest. What happens if we take a well tree back to a sick forest? It will get sick again. This means that we must actively heal the community and its institutions at the same time an individual works on his or her own healing from alcohol or drugs or other unwell behaviors. The individual affects the community and the community affects the individual. They are inseparable from the point of view of addiction recovery. Everything must be in the healing process simultaneously. The family must be part of the healing process. You know, we can't really understand why we have such enormous amounts of individuals who suffer from setback from substance use disorder. I think it's important to say, you know, 23 million people do live in recovery, and it is Recovery Month, and it's important to really honor and recognize that. But there's so much challenge around people not finding their way, and so many different theories and versions about why. And I think we learned a lot yesterday from Maya about sorry, the different reasons. Sometimes it takes 10 years and a decade of harm for an individual to seek treatment. And the family plays a crucial role in this process. Shame, denial, and the stages of change play a role. When someone is ready, they're ready, and we need to act on it right away. But the whole family is affected. And how do we heal and include the family in recovery? The two most widely used approaches to treat the entire family include a model based on the 12-step model and directly confronting the user. The 12-step approach involves loving detachment, allowing the individual to reach their bottom, and an admission of powerlessness. A rather different approach is the direct confrontation of the user using a trained interventionist in a confrontational meeting to encourage treatment seeking. Unfortunately, none of these interventions have been researched or begin with a theoretical base. So Kraft is not here to talk about those models don't work, because we know that they do, right? We know that those models work, but we need to look at all the models and all the ways to find help for a family to find recovery. And if in conversations about healing the community, I didn't mention the importance of the concept of recovery capital. So just like social capital is required for communities to function effectively, recovery capital is required for individuals to really have sustainable recovery. And recovery capital includes personal recovery capital, which means an individual's physical and human capital. If they don't have the resources to fulfill their basic needs like health, healthcare, financial resources, clothing, food, etc., it's a bigger challenge to find a sense of meaning and purpose in life and recovery. Next, most importantly, is the family and social recovery capital. These resources relate to intimate relationships with friends and family, relationships with people in recovery, and supportive partners. We need recovery capital to include the community, the family, and the culture in order to help an individual find sustainable recovery for their alcohol and drug problems. Next slide, please. So as I previously mentioned, you know, there's not a lot of options for families. Families are often the forgotten, important link when we send an individual to treatment. How much are we including the family in the recovery plan? How much are we including the family in finding their own recovery? We know everyone plays a role, as discussed in the sick forest story, of the family not being well. So the options we currently had are 12-step programs, such as Al-Anon and Nar-Anon, the Johnson Institute for Intervention. We have some mental health counseling. We have nothing, which is often, unfortunately, the option. And then we have the Kraft Family Support Program. Kraft stands for Community Reinforcement and Family Training. Next slide, please. So what is Kraft? Kraft is a highly effective, evidence-based approach for working with family members trying to cope with a loved one who is reluctant or refusing to get help for a substance use problem. Next slide, please. So the Kraft model originated with Dr. Robert Myers, and he developed this Kraft model. It is a scientifically based intervention designed to help families, or what Dr. Myers refers to as concerned significant others, and it helps families engage treatment-resistant individuals into treatment. Kraft has been studied and proven effective in getting individuals into treatment. In addition, concerned significant others who attend the Kraft program benefit by becoming more independent with reductions in depression, anxiety, and anger symptoms. Kraft can and does heal the family. The Dr. Myers Kraft model is typically provided in a clinical setting. The peer-to-peer model of Kraft, which is the model that Overdose Lifeline has been able to bring to the state of Indiana with support from the Division of Mental Health and Addiction here in 2020, is based on a model that was developed by the Utah Support Advocates for Recovery Awareness. And USARA is a nonprofit recovery community organization based in Utah. They are non-clinical and peer-led. They are volunteer-based, and they celebrate all pathways to recovery. USARA found Dr. Myers' program and adapted the book that his program is based on, called Getting Your Loved One Sober, into a 12-week program. So this program is a 12-week group education and support model that uses the book, as I mentioned, Get Your Loved One Sober, authored by Dr. Myers and Brenda Wolf, and the workbook in a 12-week structure easily implemented by trained family volunteers. Dr. Myers endorses the USARA program and the 12-week workshops in the workbook that has been developed. So we all know who have been doing this work for a while, and we heard some great information yesterday from Julia Holloway and Paul Conrad, and we'll hear more today about the importance of peer support services. And the Kraft model, the 12-week peer-to-peer model, is based on the concept of peer recovery support services, that they are non-clinical, that they're trained specialists who have lived experience, and in this case, lived family experience. And we know peer recovery support services work, and they are an important part of a treatment plan and a recovery plan for individuals. Next slide, please. So family recovery coaching, which is not a concept we talk about as much, but what is important in this Kraft model that we've been rolling out in Indiana is family recovery coaching. And a family recovery coach is someone who helps those affected by the addiction and recovery of another human being through their own recovery process. All Kraft groups are peer run by trained facilitators with lived experience. The relationship focuses on helping participants develop tools, skills, and attitudes to positively transform these relationships and restore them to wellness. A family recovery coach helps the participants define their own path to recovery wellness that includes learning effective methods of communication, setting limits, and helping your loved one find their own motivation to change. So the benefits of family recovery coaching are many. They help to establish a connection with others in similar situations, so a concept that you're not alone, right? And then you can support one another and encourage self-care, which is often a forgotten aspect in a family situation with someone suffering from substance use disorder. The groups work together, they have access to more hope, inspiration, lived experience, knowledge, and possible interventions. In the group, they celebrate each other for making important changes and have opportunities for feedback with an open and compassionate approach. They share their stories without experiencing critical judgment. And finally, they connect to resources that others have found helpful. We know that recovery depends on meaning and connection, and family support is part of that connection that supports recovery. So again, as I mentioned, this peer model works in these ways. Sorry, we have a peer-trained facilitator. We do 12-week consecutive sessions. The participants have a workbook that they follow along. They also use the Get Your Loved One Sober book and materials from the Center for Motivation and Change. This slide shows the book, Get Your Loved One Sober, and the workbook. Sorry, if you don't talk a lot in the morning, your voice just doesn't want to work. So the 12 sessions are based on the chapters in Get Your Loved One Sober, but the actual workshop does not just read the book, right? It highlights specific important points, and I'll go into that a little bit further. Overdose Lifeline, primarily because of COVID and our challenges around meeting in person, have further developed the material from USARA to include materials from the Center for Motivation and Change. Participants attend weekly sessions free of charge. They work on the sober books and workbooks that are provided. They have weekly lessons, sometimes homework practice and group sharing. And the primary mission goal of the workshops is to teach effective strategies for self-care. In addition, Overdose Lifeline provides a naloxone training as part of the 12-week sessions, and each participant is provided an overdose reversal kit. Next slide, please. So this slide, you can go ahead and advance, please, all of them. Just covers the basic topics that are shared in the 12-week session. So we go over a review of the program and what Kraft is. We spend a week on communication and focusing on how to have positive communication. The roadmap session is about looking at some of the motives behind the loved one's behavior. Play It Safe focuses a bit on ensuring there are no violent tendencies. Pick a Destination is about where do you want to be and how do you set goals. Changing reactions to responses, right? So typically when we find ourselves in a situation with a loved one who's misusing substances, we don't always know how to react as how to act rather than to react. Let the Good Times Roll really focuses on small baby step self-rewards that you can take for yourself, making changes. Definitely a week is spent on enabling and unintentional support. Problem solving is the next week. Behavior basics, again, behavior modification techniques developed by Dr. Myers. And then the last two sessions are focusing on how to actually determine the appropriate treatment model, and then recovery management in the final session. The three major goals of Kraft are to reduce your loved one's harmful substance misuse, to engage your loved one into treatment, and to finally, and most importantly, improve you and your loved one's family functioning. And then the 10 basic messages for family members are: I can successfully learn techniques to engage my loved one into treatment rather than fighting and arguing, right? Which is typically what we find ourselves doing. To understand you're not alone in this situation, which is hard. To understand the concept of catching more flies with honey than vinegar. To know that you can try as many times as you want. That it is possible to live a happier life whether or not the loved one gets better, which is a very hard concept for a family member. It helps my family when I help myself is also a hard concept. That we are not crazy, that the world of substance misuse is not black and white, and there's plenty of gray area. Labels do more harm than good. And finally, I have nothing to lose. Next slide, please. And the Kraft 3 things rule, very important, right? Things in your life can get better, or things in your life can stay the same, and things in your life can get worse, and the choice is ultimately ours. Next slide, please. Uh-oh.
It's just, there's all this pressure, you know? And sometimes it feels like it's right up on me, and I can just feel it, like literally feel it in my head, and it's relentless. And I don't know if it's gonna stop. I mean, that's the thing that scares me the most, is that I don't know if it's ever gonna stop.
Yeah. Well, you do have a nail in your head.
It is not about the nail.
Are you sure? Because, I mean, I'll bet if we got that out of there...
Stop trying to fix it.
No, I'm not trying to fix it. I'm just pointing out that maybe the nail is causing...
You always do this. You always try to fix things when what I really need is for you to just listen.
No, see, I don't think that is what you need. I think what you need is to get the nail
See, you're
out.
not even listening now.
Okay, fine. I will listen. Fine.
It's just, sometimes it's like, there's this achy, I don't know what it is. And I'm not sleeping very well at all. And all my sweaters are snagged. I mean, all of them.
Yeah, that sounds really hard.
It is. Thank you. Ow!
Oh, come on. If you would just...
Don't.
Try to see things my way. Do I have to keep on talking till I can go on? We can work it out. We can work it out.
So just a fun little video that helps illustrate that it's a matter of perspective sometimes, and oftentimes our family member isn't really interested in having us fix the problem, but rather see their perspective. And often when we step back and take a minute to understand we all have a different perspective, things can shift. So some of the important points that we learn in Kraft that I want to cover quickly is that really Kraft is not about detachment from the person you love. As much as possible, we try to help in every way to make the relationship work. We understand that bottom is different for everyone, and we can't always wait for rock bottom, especially when we talk about opioid use disorder. So sometimes there is a point when letting go is the only way of moving forward, but we don't go initially to rock bottom and detachment as the first and final option. But by the end of the journey, by the end of the family member's journey in Kraft, they will be able to see themselves differently. They will have taken control of their life and been able to focus on positive changes for themselves and be able to rationally decide, which is a very important point, where to go from here. Next slide, please. One of the key tools in Dr. Meyer's model that is also used in the Kraft peer-to-peer model is what he calls the functional analysis tool. And the functional analysis tool helps sort of lay out how to see the loved ones drinking or using behavior from a standpoint of what their external triggers are, what their internal triggers are, what their actual behavior is, and then looking at the short-term positive consequences and the long-term negative consequences. This really helps. So someone's not muted. This really helps the family member, the concerned significant other, see the motive and the thought process behind. Often we don't understand. We just know that it's harmful to us. It's harmful to our family and harmful to our love for our family member, but we can't really see the motive. So this tool is very important in the Kraft program, both for Dr. Meyer's model and the peer model, as I mentioned. Next slide, please. We also, as I mentioned earlier, spend a week talking about unintentional support. So we really help family members understand that each time we fix the situation for them, they have a powerful learning experience that no matter how irresponsible they are, there are no real consequences. And we have to really work on natural and logical consequences, and that we cannot step in, even as painful as it is, especially if it's a child, right? We need to help the person suffering from substance use disorder be responsible for their own behavior. And we focus a little bit on nagging, right? That we may think that this habit is instructing or teaching, but to our loved one, our well-intentioned comments are just plain old nagging, berating. Next slide, please. Hi, next slide, please. Sorry, thank you. So instead of nagging, we teach positive communication techniques such as I statements. So we help family members understand to think first about what we want our words to achieve, and to use our words to let the loved one know what their behavior is doing to us, and then withdraw our attention. Oftentimes, individuals with substance use disorder really don't have a full comprehension of the impact of their behavior on their family. There's so much shame and stigma involved with using that it's very painful to look at what the behavior does to your family member until recovery. Protecting. Sometimes by protecting people, we keep them from learning how to protect themselves. We don't allow them to make adult decisions, especially if we're talking about a child. So experience shows that if our loved one is not required to take responsibility for their negative consequences, unwanted behavior is likely not to change. And instead of protecting, we want to look at a more constructive way of helping. How we could make sort of a list of activities that our loved one enjoys, and focus on how we can do these things that we can't do right now because of our using if we go to a place of recovery. Next slide, please. So we work with family members to define the problem. The key to problem solving is coming up with a very specific description of the problem. So the problem can't just be you drink too much, you use drugs too much. We have to get more specific. And then we brainstorm a list of every possible solution, regardless of whether it makes sense, is realistic, or ridiculous. Next, we work with the family to implement a plan and keep track of how it works. And this is part of the homework situation. And then they come back and we share as a group how they're going to handle the problem, and then how well it worked, and then getting feedback from other group members on what adjustments need to be made. And then we evaluate, refine, or try another idea. Sometimes we have to try different things. Changes are ongoing. So as I mentioned earlier, we brought the Kraft model to the state of Indiana at the end of 2019, and have been implementing Kraft across the state with support from the Division of Mental Health and Addiction. We have conducted facilitator trainings, and we still provide facilitator trainings, and will do so into 2021. The Kraft facilitator training program works like this. Next slide, please. So the role as a facilitator coach, as I mentioned earlier in the program, is someone with lived experience. So we work to try to find individuals within communities and organizations who also have some family recovery experience, because we know that peer recovery support services work, right? So your role as a facilitator is to become part of the group, to encourage and support. Important to allow participants to learn from each other. Participants work to solve their own problems. The facilitator is not just the only person in the group who's talking. Everyone has a voice, and everyone gains skills and knowledge together following the guidelines of the workbook. As facilitators, you receive training materials. There are some posters, some flyers, some tools that we've developed through Overdose Lifeline to allow for promotion. The Get Your Loved One Sober and workbooks. We also provide a flash drive with all PowerPoints, outlines, and handouts. We have a web page with technical assistance available and resources. We do technical assistance for each trained facilitator, and we collect monthly reporting to help everyone understand. The challenges around running a group are always going to be difficult, and I've included here the website for that facilitator portal. And this is just a screenshot of the facilitator portal. We have trained over 35 individuals in the state of Indiana, and we have groups running currently successfully in 7 cities. The challenges have really been evident when COVID first hit. We were running groups in person, as I'm sure we know most recovery supports were in person, and we all moved to virtual. So the benefits of moving to virtual have been remarkable because we've been able to serve people farther spread out, right? So we've been to expand our geographic area with the services of individuals who've been attending the Kraft support groups, and it hasn't seemed to stop the effectiveness of the program. So a little bit about the results of Kraft. Participants liked Kraft because it's respectful, non-confrontational, and effective. It gives a set of skills that teaches how to help encourage our loved ones that are struggling with substance use disorder to make choices that lead to progress and healing. Important to remember, a family recovery coach is understanding, non-judgmental, an encourager, a motivator, a cheerleader, an ally, and a confidant, a good listener, a resource provider, an advocate, and has lived experience. A family recovery coach is not a therapist, a clinician, a medical practitioner, a treatment specialist, a sponsor, or a mediator. And keep in mind, this is about the peer-to-peer model and not the Dr. Myers clinical model when I talk about what the family recovery coach is not. So there's been some evaluation done on the peer model success with USARA did their own evaluation. I'll share in a minute, but I also want to share that this year Overdose Lifeline worked with Wayne State University and some interns from Purdue University to evaluate the effectiveness of the Indiana specific Kraft program. We did surveys 2 times during the 12-week sessions, and the results showed significant measures of the participants' increased perception of having the knowledge, skills, and confidence needed to improve their family's well-being. We showed improved ratings of emotional well-being of participants and struggling family members. We decreased the participant agreement with the statement, "I often think I can't do anything to improve my family's well-being." And we showed a decrease in the percentage of participants who think their struggling loved one is currently misusing alcohol or other drugs. And then, as I mentioned, USARA did their own evaluation with the University of Utah, again using pre and post testing of participants. And in that evaluation, participants reported statistically significant increases in their perceptions of the emotional, physical, and relationship well-being of their struggling family member. And Kraft family support participants also indicated statistically significant increases in their perceptions of their own emotional and relationship well-being. So again, both evaluations sort of mimic each other and the outcomes of the success of the Kraft model. I think it's important to point out that when we did our evaluation, which I didn't show on the slide, but I do have a copy of the evaluation if anyone's interested. The participants really liked the virtual model as opposed to the in-person model. We had quite a few members who had started with us in person, and they really preferred in a couple of the questions the virtual model. So interesting to see what will happen as we move forward in getting back to in-person groups, whether individuals will be as interested in attending if they have to do an in-person thing. There's some, you know, some protection in being virtual, I think. So next slide, please. So that for me is the end. So I know I'm a little short on my time here this morning, but I think it allows for questions. And this is our website, and you can see the Kraft Family Support page there on the right of your screen. You can get a lot of information again on the Kraft Family Support website about the effectiveness of Kraft. There's plenty, as I mentioned earlier, of research behind Dr. Meyer's model and Dr. Meyer's support of the peer-to-peer model as an effective way to implement Kraft. And we look forward to conducting some additional Kraft facilitator trainings. If you're interested, we have a training in October. We will have another training again, I suspect, in November. So you can find out that information on the overdoselifeline.org website. And again, I thank you for the opportunity to present today, and I hope that we can really expand the family support across the state. It is a very important part of recovery for individuals, and something Overdose Lifeline strongly believes in. On another note, I have been working with Division of Mental Health and Addiction to try to determine if we can figure out a way for this to be a billable thing under insurance and Medicaid, because it does fall in line with some of the codes that already exist. So we are working on that. If anyone has any questions or concerns about that, that is something that we've been trying to address.
Justin, thank you for that comprehensive overview of Kraft. What a fantastic evidence-based model for families. We've got a series of questions for you from Lance Dardine with the City of Indianapolis. How can local law enforcement assist with these issues and help support your cause?
Thank you, Lance. Great question, and something let's try to explore together. We appreciate you at the Behavioral Health Unit of Indianapolis Metropolitan Police Department, and I think much the way we help individuals have access to resources, we need to also help the family. So I think if we can provide you with some resources to leave with the family that may be suffering, that would be the best way. We also, those groups that exist currently, the virtual Kraft groups, are listed on the website, in addition to all the trained facilitators in the state of Indiana.
Fantastic resources. Thank you, Justin. Jeannie Reed with Pace Indy first has a comment to say thank you for all that Overdose Lifeline does. Thank you for everything that Overdose Lifeline does for the community and getting naloxone out into the community. And then a question, is Kraft suggested for young adults or maybe preteen or younger family members?
No, that's a great question. And I think the way the current model stands, there are some concepts that may be difficult for preteens. Something I think that is worth looking into, though, and how we could adapt it to provide it for the preteens, because clearly it's a necessary thing, and definitely a great question.
Are there suggestions for other models that you would have for younger children?
With affected family members?
Yes.
So currently, it's a really great question, and I don't have the best answer. No magic wand answer for this one today. There is Alateen, right, which is part of the 12-step model. I don't know of any other models currently, but definitely something worth looking into.
Wonderful. Thank you, Justin. A few questions on cost. What is the cost of the training for peer facilitators?
So currently, Overdose Lifeline has funding from the Division of Mental Health and Addiction to train facilitators at no cost.
Fantastic. And are there any costs to the family?
No cost to the family. So the model has been designed to provide the groups to the family at no cost. There is, at the beginning of each group, so in that first session, we ask the family members to sign an agreement. We provide them the books, the Get Your Loved One Sober and the workbook free, and we ask them to, if they choose to come 3 times, to sort of make a commitment in exchange for those 3 books to come 3 times. But we don't charge anything. And obviously, locally, if individuals want to take donations to help support, to offset costs perhaps of the meeting space or providing coffee, that's, if we get back in person, I should say, that's something to consider. But the model has been designed to be free to the families.
That's phenomenal. Thank you so much. A few questions regarding the role of the facilitator. A clarifying question, does the group facilitator have to be in recovery?
No, the group facilitator does not have to be in recovery. However, the model is designed for the group facilitator to have lived experience or as a family member. And there is a difference.
Great, thank you for that. A couple of content questions. Is Kraft offered in Spanish?
Currently, no.
And then specific to content, what are some ideas or incentives to get family members connected to a group and participating in the 12 weeks?
So some groups have, again, offered incentives such as a light, again, if we were in person, right? It's a little more challenging virtually, light refreshments. We have no evidence from any of the groups in Utah or anything that we've been running thus far in Indiana that honestly an incentive has been required, as much as what we found is by the time someone finds themselves seeking out Kraft, they're ready for a change and they're seeking that support. And once they attend once or twice, they feel that solution, and that's the incentive that keeps them coming.
Justin, could you share a little bit about the logistics of how you group families and how they're referred into the program?
I'm not sure I understand the logistics of how we group families question, but we basically, at this point, the referral is about local, right? So for example, the group in Kokomo is locally promoting their group through their own community grassroots channels. We promote them as well through our website and social media. Typically right now, all groups are meeting on Zoom, so we provide those Zoom links and help promote those local groups. Does that answer that question about referring individuals to groups? So if we were in an in-person situation, obviously we would be referring them to the group local closest to them geographically. We would do our best with that regard.
Understood.
Yep.
And the folks.
Go ahead.
Oh, no, please go ahead.
I just was going to circle back to the first part of that question that I didn't quite follow.
So the question regarding the family setting was due to, because it's virtual, how are the families being grouped together? versus if it was in person and local?
Yeah, grouped together. I still don't understand.
I think the question is more towards the Kraft is a training model, and then the trainers are then going out to support and facilitate the families locally. Is that a correct statement?
Yes.
Okay. I think there was some confusion that families would actually attend the Kraft model.
The whole family or just the significant other who chooses to attend?
Could you maybe walk through? Yes.
Yeah, so it's two different things, and I apologize for that confusion. In the beginning of the presentation, I tried to provide an overview of what Kraft is and what a Kraft group would look like, right? And then I shared that Overdose Lifeline trains facilitators to run these groups. So, for example, we have a great recovery advocate by the name of Joyce Cox, who's out in Knox County area, and she understands the value of the importance of providing resources to the families. So she attended the Kraft facilitator training, and now she runs a local group in her area where she invites affected family members to attend the 12-week session, and she facilitates that group.
Great, thank you for that clarification.
Apologies for the confusion. Sometimes when you understand it in your head, it seems logical, but it's not always as logical when you say it out loud.
Great clarification, though. There are many folks that have typed in a question about where to find the information on the Overdose Lifeline website.
Yep, there it is. Our work and then Kraft Family Support. Yep, that's it.
And then a few questions on the rural impact. Has the Kraft model been trained to facilitators in rural counties as of yet? And if so, which counties?
Yes, so we've trained some folks from Jay County, from Noble County. I mean, I would consider Knox County rural. We have Washington, Indiana, which, am I right, is that Davies County? And we have on deck to train individuals in Scott County, and just in August we were in Dearborn County.
Excellent. A few questions on quality and metrics. Will Purdue continue to track outcomes in Indiana? And if so, do you have the publications to share?
We will continue to do the pre and post testing evaluation, yes, every time we run a group, and we also share that ability with the facilitators who've been trained who are running groups, and we ask that they collect that data. We've set it up to be a SurveyMonkey link, so it's easy for them to provide the pre and post test to the participants. And we work with Wayne State University. We only worked with Purdue because we had the intern from Purdue, but we have been working with Wayne State University because of our connection to Brad Ray. For some of you who know Brad Ray, he's a member of the Overdose Lifeline board, and so he and his team help us with our evaluation.
Excellent. Understandably, the facilitator training is virtual currently. Do you have any expectations of when it will come back to be an in-person training?
No, I mean, we did an in-person training in August. So we are willing to do in-person trainings, and we can do virtual trainings. And it's really up to the organization that we're working with on doing that training and the participants. We understand some people aren't as, you know, they're more cautious and don't want to do an in-person training. We had to postpone the training we did in Dearborn County. It was originally scheduled for May, right? And we pushed it back to August, but we were able to do that in person with social distancing. And I think as our state continues to open up, the ability to do that in person is more available. And we're not opposed to that. It's just about the partner that we're working with and how to make that happen for everyone involved.
Thank you, Justin. You mentioned earlier in your presentation about multiple models. There's a question from Amber Rourke about when an individual is already in, a loved one is already in a residential treatment center, would this be appropriate for families to also participate in?
Absolutely. The family needs skills and tools and resources, whether their individual loved one is in treatment already or not. So absolutely.
Great, thank you. And then there are multiple organizations that have requested additional virtual information. So we've relisted the overdoselifeline.org website there. Justin, in addition to your website, is there another avenue for organizations to contact you or Overdose Lifeline representatives to learn more about the Kraft model?
They're welcome to send an email. They can send an email directly to me, which is justin@overdoselifeline.org, or they can send an email to Cameron@overdoselifeline.org.
Thank you. There's a couple more questions that are typing in the question pane, so we'll give everyone a few more seconds to finish out their thoughts. A couple marketing questions. What is suggested for marketing-based promotion materials for family members to let them know that there is such a model and that there is help for them to understand and cope with what their loved ones is going through?
Can you summarize that a bit? So what are the best marketing tools? Is that how you would summarize that question?
Yes. Do you have existing marketing tools and how would?
So we do have flyers and social media posts that we have created, and that can be personalized, localized for your needs. And then we can, you know your community better about how to reach the family members, right? But we do provide those templates and those resources and that assistance.
And has that marketing promotions differed in rural? What are additional tools or mechanisms for rural marketing?
So I think, again, really it's about where you can find the families and where those families are and how you reach them, and you know that best in your own community. So we haven't found anyone to express any different ways as opposed to rural and urban, but just necessarily about where you know your family members are. So where are they congregating? Perhaps you work with your local faith communities to share the information. Perhaps there's, currently right now it's more difficult because we're not doing much in person. We're not going places where we might see information. So we have to get more creative about how we can reach our community members with communication. Is it possibly radio? Is it possibly any kind of print material? Is it possibly a neighborhood organization?
Great recommendations for stakeholder outreach in both urban, rural, and general access and communities. We had a great number of comments thanking you on the excellent presentation and about the information shared on Kraft sounding like a great model, and so forth. So unless there are any additional questions, we'll stay on the line for just a few more minutes. If any of the attendees would like to provide any additional comments or questions for our presenter, Justin Phillips. Thank you for the great comments. Thank you for the great engagement, everyone. Justin, again, additional comments thanking you for your presentation and great information. There'll be several organizations following up directly about how to bring Kraft into their communities. Appreciate the presentation and thank you again for all that you do for the state and all of Overdose Lifeline's training and support in support of recovery communities. Thank you for your time today.
Thank you, everyone.
We're going to now turn to Blake Wood to cover the next session.
Thank you, Sunny. And Justin, thank you again very much for providing that essential information and for launching the second day of the symposium off to such a strong start. Our next session will focus on best practices. Part 1 is best practice in treatment, the Dove House model, and Part 2 is best practice in recovery, the Oxford House model, and evidence-based recovering housing model. That session will get underway at 10 o'clock a.m. Eastern Time. As with yesterday, please remember to use your join link to log on to the webinar. We're looking forward to having you join us for that session as well, and have a good morning.